and what happens if our only option for care fails.
Concern and support shared by many tonight involving the potential mergers involving both Duluth hospitals.
At a meeting this evening, the public got the chance to share thoughts on 2 hospital mergers that would impact patients here in the Twin Ports and all across the region.
You'll remember in July, Essentia Health expressed its intent to fuse with Marshfield Clinic Health Systems. Well, St. Luke's Duluth also recently announced its goals to merge with Aspirus Health. Marshfield and Aspirus are both based in Wisconsin. But before the mergers can be finalized, the Minnesota Attorney General has to sign off.
Now, part of that process, gauging whether the moves have public support. Northern News Now's Cara Kopp was at tonight's public meeting where there was no shortage of strong opinions.
How big do we as a community of patients, providers, and workers want these systems to be? And what happens if our only option for care fails?
That was just one opinion from an Essentia nurse sharing her concerns about the Essentia Health and Marshfield Clinic Health System merger Wednesday night. And she wasn't alone in sharing that sentiment with the Minnesota's Attorney General.
Members are already stretched in many areas, consistently asked to do more with less. It seems entirely possible this trend will continue as Essentia and Marshfield start to bridge any gaps between their existing operations.
However, some educational leaders spoke in support of the Essentia Marshfield merger, saying the expansion could give their students more room to train on site.
Our waiting lists for many of these programs are extensive. We'd love to commit more students to meet healthcare demands of our communities. We have the capacity to expand. However, we can only do this if we have more clinical sites to guarantee clinicals for our students.
Many city and county leaders also spoke Wednesday night in support of the mergers as long as the public is given the same access to care as they are now.
These 2 systems are vital employers and community partners. Healthcare options within our region are important so that our communities can be best served by the systems that fit their needs.
The Deputy AG present to hear all the concerns and will now weigh them when considering approval.
We want to hear concerns people have, but we are asking questions about all the issues we see as well. And when this is over, we'll let people know what we find.
In Duluth, Cara Kopp, Northern News Now.
A MNA nurse who works at St. Luke's offered this statement, saying in part that they're pleased to hear Aspirus Health's pledge to recognize their union and contract. Meantime, the MNA's president, Chris Rubesh, who works at Essentia, says the group is reviewing the impact on nurses and patients. They expect Essentia and Marshfield to recognize their union and contract as well. Now, the Attorney General says if everything checks out, the mergers will be allowed to go through in the spring.